Hello, my name is Danielle Jordan, and I am a student in the Applied Behavior Analysis program at Southern Illinois University. I would like to thank Dr. Dixon, Dr. Hurst, and Dr. Redner for taking the time to view my presentation and sit on my committee for my thesis defense. The title of my thesis is Evaluating the Validity and Efficacy of the PEAK-E curriculum. In recent years, there's been a considerable uptake of children diagnosed with developmental and intellectual disability. 1 out of every 6 children is diagnosed with a developmental or intellectual disability, and 1 out of every 68 children is diagnosed with autism spectrum disorder. The DSM-5 released in 2013 new criteria for diagnosing autism spectrum disorder. It is split into 2 categories. The first is social communication and interaction. The second is restrictive and repetitive behavior. Autism often presents with notable difficulties in the area of receptive and expressive language. The focus of treatments for these difficulties is often based on developing and improving social skills, academic instruction, and behavior. Several studies have been conducted on several types of treatments. Unfortunately, a large amount of these studies lack experimental control and empirical evidence. Advocates have been searching for a type of treatment based on research that is empirically supported and provides evidence of effectiveness. ABA is an applied behavior analysis, and it is a science committed to improving socially significant behavior in order to enhance a client's life. By seeking to identify the function of that one behavior that is measurable and needs improvement. By analyzing and manipulating the environment and controlling the behavior and the environmental effects by creating a conceptually systematic, effective procedure that is objectively defined and operationally conducted, ABA has become the go-to treatment intervention that is based on peer-reviewed evidence. In fact, it is now law that all those on psychotropic medications must have a functional behavior analysis done and a behavior support plan based on that FBA completed to maintain the behavior. Because language is the foundation for all learning, language itself must be understood, which is exceptionally hard for those with autism. Language is both receptive and expressive, but both categories are considered verbal language according to B.F. Skinner. B.F. Skinner's definition of verbal behavior is defined as the speaker's behavior reinforced through the mediation of the listener's behavior. Essentially, verbal behavior is behavior whose reinforcement comes from the listener. Verbal behavior is both formal and functional and is split into several categories. A verbal repertoire is a set of verbal apparents. A verbal apparent is a group of verbal behaviors. Verbal apparents are further split into 6 main types. Amand is a demand, a tact is naming something, an echoic is repeating exactly what is said. An intraverbal is a conversation. A textual is reading and speaking what was read, and a transcription is writing what is spoken. Relational frame theory was founded by Stephen Hayes with the combined efforts of Dermot Barnes-Holmes and Brian Roche. It focuses on the complex verbal behavior while acting as a post-Skinnerian approach to language. RFT believes being able to relate all types of Skinner's verbal behavior with symbolism creates a fully functioning language. It is based on Sidman's 1971 study. Murray Sidman found in his study conducted in 1971 that an intellectually and developmentally disabled young man was able to unexpectedly match spoken words to printed words and printed words to pictures. The boy was only taught to match spoken words to pictures and printed words to spoken words, making his ability to match spoken words to printed words and printed words to spoken words a derived relation. Sidman concluded that the boy was able to do so because the printed words and pictures became equivalent to the same auditory words. Stimulus equivalence, in other words, derived relational responding, is the untrained understanding that relationships exist between different items and events in the world. Stimulus equivalence is said to have occurred when one of 4 types of relations have been made. Reflexivity is identity matching, in other words, matching same to same. An example of this would be matching A to A when given a choice between A, B, and C. Symmetry is the functional reversibility of stimuli. This is matching A to B. Transitivity is symmetry and reflexivity combined. This would be matching A to C. And equivalence occurs when all relations are matched and C to A is obtained. For example, if A equals A and A equals B and A equals C, then C has to equal A. In these four features of stimulus equivalence exist even more detailed relations that can be made. Relational frames are specific types of relational responding, which specify relationships of things in the world to understand human language. An example of this would be that cars, trucks, vans, buses are all in the relational frame of vehicles. The very first relational frame to often occur is coordination, which is similarities, sameness, and naming. Given the fact that stimulus equivalence is an inferred ability, it is imperative to have an assessment that can directly determine if an individual is able to derive equivalence relations. The Promoting the Emergence of Advanced Knowledge, also called PEAK, assessment and curriculum does this by using ABA principles, Skinner's verbal behavior, and RFT to teach more complex language skills to those with autism. PEAK utilizes the assessments in order to determine specific language skills that need improvement and the curriculum to improve them by employing a trained test tactic. PEAK-E was used for this study. The instruction book provides assessments and programs with clearly defined objectives, materials, and procedures. When incorporating assessments and curriculums and when completing interventions in behavior in general, all data must be valid and the treatment must be effective. Validity is the extent to which the data is directly relevant to the behavior being measured and the cause for measurement. There are three types of validity. This study focused on construct validity, which assesses how well an assessment lives up to what it says it will do. Efficacy is how effective a treatment is. This study employed a single case multiple baseline with an a priori baseline and a tau u statistical analysis to demonstrate effectiveness. The purpose of this study was to use a single case multiple baseline across skills designed to evaluate the validity and efficacy of the PEAK assessment and curriculum module. There were 3 participants for this study, 2 boys and 1 girl. They all have a primary diagnosis of autism, and they are all verbally capable, independently functioning adolescents. The setting was a group home, which the participants lived in an isolated location with a table, 2 to 4 chairs, their preferred items, and the items needed for the PEAK pre-assessment, assessment, direct training, and post-assessment. Materials used were the PEAK pre-assessment, the PEAK assessment, and the PEAK direct training curriculum. This table demonstrates each stimuli that was used for each program for the participants. Each participant had 3 programs, and there is a list of stimuli that explains what A, B, and C were. The train relations and the test relations are also listed. A single case multiple baseline across skills with an a priori baseline was used for this study. An a priori baseline was used to minimize potential carryover from the baseline to the training phase. In order to avoid the risk of exposing participants to too much of the experimental design in baseline phases were predetermined. For the A to B relation, baseline was 4 trials in order to establish a trend. For the B to A relation, baseline was 7 trials in order to maintain a multiple baseline design. And for the A to C and C to A relations, baseline was 8 trials in order to demonstrate experimental control. The PEAK EPA was given first to determine the starting point of the assessment and to get an initial gauge of the participants' language skills. The PEAK assessment was given second to determine the ability level of the participants with their ability to determine derived relations and to determine where to begin the direct training at. The PEAK-E direct training followed the PEAK assessment. There were 3 programs that were done for each participant. Ben completed program 9O, 9P, and 10A. Taylor completed program 10A, 10B, and 10C. And Phelan completed programs 10Q, 10R, and 11A. Upon the completion of the PEAK direct training programs, the PEAK-E assessment was given as a post-assessment. The dependent variables in this study were the results from the PEAK-E pre-assessment, assessment, direct training, and post-assessment. IOA was completed for each of these, and it was determined by dividing the total number of items scored the same between the 2 observers by the total number of items, then multiplied by 100. These results demonstrate the results from the Peak E pre-assessment. There was a score given for each relation that was totaled in the end. That totaled score is what determined where the participant would begin the Peak E assessment at. Ben received a score of 28, Taylor a score of 35, and Fallon a score of 39. All of the participants began the Peak E assessment at Program 1A. IOA was 97%. This demonstrates the results from the Peak E assessment and the Peak E post-assessment. As you can see, all participants were able to increase their scores on the post-assessment by a few points. Here you see Ben's graph. The baseline data for the AB relation in Program 9O and all the relations in 9P and 10A showed an increasing trend in baseline. Therefore, a tau u statistical analysis was performed to ensure that training was the cause of the derived relations. The tau u results were significant and suggest that the training had a large effect on the results. During the direct training, Ben completed 3 programs and was able to master all 3 skills. They were all transitive programs. He was able to master Program 9O on trial block 15. He was able to master Program 10A, multiple actions and outcomes, on trial block 12, and he was able to master Program 10B, which was addition, on trial block 17. All of Ben's data was slightly variable throughout relations and always showed an increasing trend. Here you see Taylor's data. Baseline data for all relations in Taylor's programs 10A, 10B, and 10C had an increasing trend. Again, a tau u statistical analysis was conducted, and it was proven significant and suggested that the training had a large effect on the results. During direct training, Taylor completed 3 transitive programs. He was able to master each skill. Mastery of Program 10A addition was completed on trial 17. Mastery of Program 10B subtraction was completed on trial 18, and mastery of Program 10C multiplication was completed on trial 18. All of Taylor's data was variable with an increasing trend. Here you see Fallon's results. Baseline data for the B to A and C to A relation in Program 10Q, the A to B and C to A relation in 10R, and the A to B and B to A relation in 11A showed an increasing trend in baseline. Again, a statistical analysis, tau u, was completed and was found significant and suggested that the training had a large effect on the results. During direct training, Fallon completed 3 equivalence programs. She was able to master each of the skills. Data was variable and showed an increasing trend or was stable. She was able to master all 3 of these skills. The first one being 10Q, facial and body recognition. Mastery was reached on trial block 16. Mastery was reached of the second program, 10R, symbolism, on trial block 15. Mastery was reached of the third program, 11A, metaphorical emotions, on trial block 19. The current study sought to evaluate the construct validity and efficacy of the PICI training module in adolescents with autism using a single case multiple baseline across skills design. It concentrated on training transitive and equivalence relations. All participants successfully derived all of the relations and were able to maintain and advance them. These results support and expand on previous studies done on Peak E and on the Peak module as a whole as a reliable, valid, effective assessment and curriculum protocol. Limitations that occurred in this study. The experimenter was not a familiar face or person to the participants, and the experimenter was the only one who was running the trials. The participants were seen very minimally due to their schedules, and there were several distractions within the home environment that could be heard during training and the assessment and pre-assessment. Specifically, Fallon had a difficult transition at school in the beginning of the year, which delayed assessment and training time and eventually acquiring her skills. There were only 3 participants in this study, and all of them were very similar in intellectual ability with varying degrees of severity. There were small changes made to the Peak E protocol when it came to some stimuli for 2 of the participants due to experimenter error. And most importantly, there was an increasing trend in baseline. Typically, during baseline phase, there is no trend. This is limiting to the current study because it alludes to the possibility that the participant could have gone on to learn the skill had the test trials continued instead of transitioning into training. However, the scenario is quite improbable due to arbitrary stimuli, and to support this improbability, the tau U statistical analysis was completed to demonstrate that the results obtained were significant and due to the training, not by chance. All tau U results for every baseline that displayed an increasing trend came back significant and suggested that the results were due to the training, not chance. Future research and considerations should consider doing future studies similar to this one on implementing the Peak E module specifically in a better controlled environment, following the peak procedures exactly, and allowing a longer length of time for the acquiring of skills, while including a greater amount of participants with varying degrees and disabilities on different severity levels. Overall, this study expanded on and promoted further appreciation of and knowledge of promoting the emergence of advanced knowledge of relational training protocol. Again, I would like to thank Dr. Dixon, Dr. Hurst, and Dr. Redner for taking the time to view my presentation and to sit on my committee for my thesis defense.